Then comes my next question, which should be an easy one. What's your favorite GPCR?
Yeah, I mean, up until a year or so ago, I feel like I would have had to say beta 2, out of hometown
R-
pride. But I do think that I've gotten very excited by the work that our lab is doing on the proton sensing receptors in GPR65, and just generally the field of these. I don't want to say orphan receptors because at least this one we kind of know the agonist in there. I feel like there are a couple of other ones, including one that I might be working on in the postdoc, fingers crossed, that we know a little bit about what might be activating them, but they're certainly understudied,
Yeah.
and they're still known by their GPR whatever designation, and a lot of them seem to have either some amount of either constitutive activity or ubiquitous ligand presence,
Mhm.
lipid sensing receptors and things like that, where it's not necessarily that they're constitutively active like on its face, but just that they always have access to these lipid ligands. So I think that these kind of classes of receptors where it's maybe a little bit less about, they're activated by a hormone or something like that, but the trafficking is the main modulator of their function or the expression level. And so these slightly less conventional, at least by the canonical adrenergic, opioid, dopaminergic type of
Mhm.
regulatory mechanisms. I think those are the ones I'm most interested in at the moment.